Hello everyone, I am doing a little series of Ask ChatGPT your plastic surgery questions. So what I did today was I asked ChatGPT what are the most important questions a patient should ask before having facelift surgery. I've been doing this for 15 years. I think we do a good job with answering all the patient's questions or the FAQs, but I've asked ChatGPT what are the most important questions and they come up with a list of 20 questions. So I am going to go over them one by one and we'll do a little series and hopefully you will all find this helpful. So yes, I am board certified in otolaryngology, head and neck surgery, so I'm a head and neck surgeon, and I am also subspecialized in facial plastic surgery, so I have 2 board certifications. Well, this is all I do. I don't do anything else. So this is another excellent question to ask your surgeon. If you look at my profile, look at my feed, look at my reviews, look at my before and after, they're basically all facelift patients. And I think the most important thing also, if you see me over the last 10 years, you'll see all my patients, all my posts are all facelift surgery patients. We perform a couple hundred or a few hundred every year. There are some years we do more than 300, some years we do about 200, so I've done thousands of these procedures. I explain to my patients there are 4 main risks with every surgery, not just facelift surgery, and all the risks that we explain are basically an offshoot of one of these 4. We say bleeding, infection, scarring, and nerve damage. Bleeding is always a risk whenever we make an incision on a patient, so there are things that patients can do before and after surgery to minimize those risks, and part of that is avoiding medications such as aspirin or Motrin or Advil, certain vitamins like fish oil, avoiding alcohol a week before and a week after surgery. All those things can minimize your bleeding. There's a risk of infection, which is why we have a protocol. We have our patients follow up before surgery, and my nurses will explain that. We'll also give you antibiotics for after surgery, and we keep a sterile field in surgery. There's a risk of scarring, which is rare, but it's always potentially there. Now, scarring for you may mean something different than scarring for me, but whenever we make an incision, you're always going to have a thin line wherever we make that incision, and my job as a plastic surgeon is to minimize those, the appearance of the scars. And there's also a risk of nerve damage, and there's 2 kinds of nerve damage. There's nerve damage where you have loss of feeling, where if I touch your side of your face, you can't feel it, or the top of the ear, you can't feel it. And there's also nerve damage where you can't move parts of your face, because the facial nerve is a nerve that we see during surgery and we avoid damaging it during surgery. So all of those are potential risks during facelift surgery. Excellent question. By the time patients come and see me, they've spoken to about 3 or 4 of my staff or my team members, and most of my patients who are good surgical candidates end up speaking to me. Patients that have very little skin laxity, that are not medically cleared or are able to undergo a surgical procedure, for all those patients, we can recommend other non-surgical or other alternatives other than facelift surgery. For all my patients who come and see me for facelift surgery, I do discuss other options. However, by the time you come and see me, you're probably a good candidate for a facelift surgery, and I will discuss that with you during our consultation. I think patients can get a little bogged down in the details and minutiae. I think every surgeon out there has their own brand name or technique they claim for their facelifts, but in general, it's a 2-layer surgery. The first layer is tightening muscles. The second layer is removing the extra skin. How those muscles are tightened and which direction you're pulling or lifting, and how are things sutured or sewn back together, and how much skin is taken out and what vector skin is pulled will vary from surgeon to surgeon. So my suggestion is look at before and afters and speak to your surgeon. If you have a preference for a certain technique, which is kind of odd because I'm not sure why a patient would have a preference for a specific technique, but my suggestion is trust your surgeon, trust their before and afters, and trust their expertise by the time you've chosen a surgeon. Yes, yes, yes. So if you follow all my social media profiles, we post our facelift patients daily. I want you to know what you're getting into, so we'll post them in the early healing, we'll post them in late healing. We show their incisions, we show their bruising. We try not to hide anything because we want our patients to be well informed. So for my patients, we offer two kinds of anesthesia. Number one is local anesthesia with oral sedation. So that's quote unquote an awake facelift where patients are receiving oral medicines to relax them. So you'll get a combination of some Valium and Vicodin. So I joke with my patients, I say it's like you've had a couple martinis. We'll sit back in the operating room. Once I put the local anesthesia in their face, you'll be sleepy, but you won't feel any pain. You'll feel some tugging and pulling. So it's similar kind of surgery like when you go to a dentist. When they're working in your mouth, you're not sure what they're doing, but they're working away there. But it's a little more fun because we've given you the Valium and the Vicodin. The other option is IV sedation, where you get an intravenous medication called propofol. It's the same medicine and anesthesia used for patients undergoing a colonoscopy surgery. So those are the two options. If you're doing the IV sedation, there'll be an anesthesiologist present. If you're doing it awake with local anesthesia and oral sedation, we don't have an anesthesiologist. In the operating room, I have my operating room nurses and certified surgical technicians. Great question. The surgery for my patients are performed in our offices. We have two locations. The Long Island office has 2 certified operating rooms. It's accredited by the American Association of Ambulatory Surgery Centers, or Quad ASF, and the New York City office has 1 operating room that's also certified. We undergo rigorous training, we undergo rigorous protocols for inspections, and we follow all of the requirements to get certified. We even have certified personnel in the operating room. So it's very important that you ask your surgeon who's in the operating room with you, because a lot of times they're not certified or real nurses or medical professionals in the operating room. So you got to be careful with that. The estimated recovery time is a good 10 to 14 days initially for facelift surgery. So I tell my patients there's an initial healing and a long-term healing. So most of our patients are restaurant ready by about 10 to 14 days, and the full healing will take months and months. And what I mean by that is a little numbness on the side of the face, a few bumps, a little bit of scar care or incision care that needs to happen after 2 weeks. Part of your surgical journey with us is you will schedule a 30-minute pre-operative appointment with our nurses. And also when you leave our office, you will get a booklet that kind of explains what you need to do before and after surgery. So my nursing team will review with you some good before care and after care, review what to wear, review what to eat or not to eat, review how to get your medications, what medications to take. We have a certain protocol that you can clean your face with ahead of surgery. So all those things my nursing team will review with you. We have videos on our YouTube to show the aftercare, how to manage the incisions, how to manage the bandages, all of that. So we will definitely review that with you after surgery. I explain to my patients that it basically lasts your entire life. So once we make you look about 10, 15 years younger, you're going to age from that point going forward. So I think the other part of the question is, are there things that I have to do to maintain my results, or when do patients come back for a second facelift? A lot of patients will come back after 8 or 10 years for tweaks or touch-ups. You probably never need as extensive of a surgery as you had the first time. And then there are things that you can do to maintain your results, and that is something that we will go over with you after surgery. Long-term considerations is basically care for the incisions around your ears. Sometimes the skin is a little sensitive after surgery, so we'll review with you some good skin care after surgery. So the 4 main risks if you have some bleeding after surgery, that's why we monitor you closely the first 2 weeks. If you're going to have some bleeding, it'll happen within the first 24 to 48 hours. If that happens, we will treat it. We drain the fluid. If you have any infection, we also monitor you closely the first 24 to 48 hours in the first 1 to 2 weeks. If you have an infection, we will change your antibiotics, we will drain the abscess. All those things are possible things that can happen. Scar care is part of your long-term care, so we will review with you things you can do after surgery to minimize the scarring. We can do lasers for you, we can place steroid injections to help minimize the scarring. You will use sunscreen on the incision sites. You will use silicone-based scar gels for these incisions as well. So costs are something that is listed on our website. There's a link for all the pricing for all the individual procedures, and my team will go review all the pricing with you, and yes, it includes all the follow-up visits at my practice. In my practice, we don't take any kind of insurance, so we don't work with insurance at all. Excellent question. You will have my cell phone number after surgery, so usually patients need, if they do need to reach me, they can reach me for the first 24 to 48 hours directly. Once you have my cell phone number, you have my cell phone number. But most patients need it for the first 24 to 48 hours just to make them comfortable. But I usually see you within the first 24 to 48 hours as well. We have an app called Clara. It's a HIPAA compliant messaging app that my patients can also video conference us with, send pictures through it, ask questions, and that's also a monitored chat during office hours as well. Plus, all patients have our office phone number. So there's multiple ways to get a hold of us, but the important thing is you have access to me directly right after surgery. Great question. We want you to maintain your youthful looks. So I explained to my patients a few things they can do after surgery. Number one is keep up with some good medical grade skincare. We'll review that with you after surgery. Number two is minimize exposure to the sun, as that tends to age you. Smoking tends to age you, and large fluctuations in weight, whether it's weight gain, weight loss, all those things can kind of stretch your skin. So you kind of want to keep your weight where it's at and try not to fluctuate, and you want to maintain an overall healthy lifestyle. Then there are things that we can do to your face to prolong the results or to maximize the results. And there are a combination of skin tightening procedures, a little Botox, a little bit of laser skin resurfacing are all great things that you can do to maintain the results. You will see us the next day, and then usually 1 week and 2 weeks later, and then it's 1 month, 3 months, 6 months, and a year afterwards. If there's any trouble or you need to be seen more sooner, we're happy to see you sooner. If you want to schedule virtual visits, we can do that. For a lot of our patients that come in from out of state, out of the country, we usually see them for the first week, and then we monitor them afterwards virtually post-op. Yes, we have been doing this for a very long time. I'm blessed. My patients are very gracious to allow us to use their pictures, use their testimonials. We have lots of reviews online as well. And your consultant can give you access to patients if you want to speak to them. Great question. We will hold your hand and we will walk you through everything. There is a revision rate, less than 1%, but there is, if we do 200-300 facelifts a year, there are going to be a few patients that want extra touch-ups or want some extra work done, and that's a conversation we have to see what we can do for you to make you happy. And finally, remember, it's crucial to have an open and honest conversation with your surgeon to ensure you fully understand the procedure and its potential outcomes. That's from ChatGPT. I've answered all these questions. If you have more questions, please reach out and we'll be happy to answer them.